Good morning to everyone. So this is a topic about dealing with an anxious child. A peculiar topic, you would imagine, something which is not frequently spoken about in many places, nor in the conferences. That being said, admission to hospital or a visit to a hospital can be a frightening experience for children and parents of the children. So I think it's very important that the hospital experience is pleasant, so that subsequent visits to the hospital, they don't have the fear of coming to a hospital or meeting a doctor or a healthcare professional for whatever reason. So what is different about anxiety in children? Children as a group, they are a lot more anxious than adults. There could be various reasons for this one. It could be a fear of having a needle, or it could be fear of separation from parents, or it could be that they view the hospital visit as something harmful is going to happen, and so on. So we need to judge the anxiety levels of the child, and our plan of anesthesia has to be tailored accordingly. Third thing about this children's anxiety is parental anxiety. Parents also have significant anxiety when a child gets sick. I'm sure all of you who have children would have realized by now that if a child falls sick, we become anxious very quickly and we start worrying about things. Another thing about anxiety in children is it can significantly impact the way these children behave in the perioperative period. So which kind of children are more at risk of being anxious? So it's generally more common in the younger age group. So children between 1 and 6-7 years will be quite anxious with any strangers. Having said that, even we have older children who come with a lot of anxiety to the hospitals. Very important reason is if a child has had a previous admission to a hospital and they've not had a good experience, then they carry the memories for years to come, particularly if they've had a very unpleasant or a painful experience in the hospital subsequent to a surgery or even a medical admission requiring IV antibiotics. So it's very important that they are dealt with during every admission with care, comfort, and a pain-free operative experience. So yeah, children who've had multiple